Hi, I'm Dr. Nicordelai Corte, and I serve as AARP's Senior Advisor and National LGBTQ Liaison. You know, right about now, I'm thinking about my great aunt. We used to call her Aunt Slim. And I'm thinking about her valiant fight with Alzheimer's. And it's not lost on me that so many of you gathered today are probably thinking about somebody special to you who's engaged in their valiant fight against Alzheimer's or dementia. And that's why AARP is so proud to support the continued efforts to address this terrible disease, to learn everything we can about this terrible disease and find a cure for this terrible disease. And we can't do that if we're also not engaged in our continued efforts to build equity through research, through vigorous advocacy and public engagement. And so as we think about what it's going to take to deliver a full pandemic recovery, we cannot turn a blind eye to all of our communities, while some of our communities benefit from such research, from such advocacy, from such public engagement. We are so proud to partner with Us Against Alzheimer's and their continued efforts to build equity. The last thing I'll say before we start the National Alzheimer's Summit is that it's critically important, more now than ever, that we begin to think about this work a little bit differently, that we begin to think about longevity as a justice issue worth fighting for. For more information on the work that we're leading at AARP, you can visit aarp.org/build equity. That's aarp.org/build equity. Stay safe, get vaccinated, and enjoy the summit.
As it stands, approximately 6.2 million Americans aged 65 or older are living with Alzheimer's disease, and women and communities of color face disproportionate impacts of this disease. But Alzheimer's and related dementias don't just affect the person that's living with the disease. I'm a working mom whose mother currently has Alzheimer's, and I know all too well the devastating toll that Alzheimer's can have on primary caregivers and families as a whole. Caring for a loved one when you don't know if it's going to be a good day or a hard day can be overwhelming, and at times it can be really heart-wrenching. And that's just one of the challenges that patients and families face. Within the next decade, Black and Latino families are going to face a disproportionate burden of the disease and the challenges that come with it. So we have to think critically about these disparities, and we have to take action now to try to close those gaps in diagnosis, treatment, and care. One thing that we can do to make life easier for patients and caregivers is to ensure that they have access to the information and support they need as early as possible. As millions more Americans, particularly in communities of color, are expected to be diagnosed, it's vital that every family have early access to the care and the resources that they need. Early diagnosis is just one of the many ways that we can take action to address health inequities. And there is so much more that needs to be done, but we cannot do this alone. And that's why I'm always proud to partner with Us Against Alzheimer's and the organizations that are represented today to discuss additional ways in which we can address brain health and equity.
As Surgeon General of the United States, I heard loud and clear the voices of senior Americans who feared losing their cognitive ability, as they may physically outlive their deteriorating brain function. What we do know is that cognitive decline is not inevitable. There is much we can do to prevent and or mitigate cognitive decline from Alzheimer's disease and other dementias. In addition, we also know that controlling lifestyle choices and health risk factors can prevent and or mitigate progression of dementias. Almost a half of dementias can possibly be prevented by eating healthy, staying physically active, socially connected, never smoking, getting good restful sleep, and aggressive prevention and or treatment of diseases like diabetes and hypertension and obesity. Unfortunately, as we know from the predictive value of the social determinants of health, chronic diseases, COVID, and now dementias as well, communities of color and females have a higher incidence of Alzheimer's. By 2030, over a third of Americans diagnosed with Alzheimer's will be Black or Latino. All of this is complicated by a rapidly aging population, saddled with preventable chronic disease, cared for in a health system more aptly termed a sick care system that is inadequately structured and staffed to address the needs of the tsunami of Alzheimer's disease and other mental health and physical health challenges that are before us. We all want to live longer, younger, healthier, happier, and cheaper. Therefore, as a nation, we must prioritize healthy aging with a focus on prevention and treatment of dementias like Alzheimer's. We must understand that the public we have the privilege to serve is depending on us. For the challenges before us are not only of a health or economic imperative, but actually they're also national security issues. The window of prospective opportunity is closing. If we miss it, we are destined to be overwhelmed by preventable disease and economic burden while trying to survive what we could have prevented.
Hello, everyone, and welcome to this Us Against Alzheimer's National Summit event, a town hall on public health leadership in the fight against Alzheimer's. I'm Usha Lee McFarling, a national science correspondent at STAT focused on covering health inequities, and I'm delighted to be moderating this discussion with our two esteemed guests. I'll first introduce Dr. Joycelyn Elders. She was the 15th Surgeon General of the United States, appointed by President Clinton in 1993, becoming the first African American and only the second woman to lead the US Public Health Service. And that's just one part of her amazing career. She's the first person in her home state of Arkansas to become board certified in pediatric oncology. And as head of the Arkansas Department of Public Health, she spearheaded campaigns to include sex education and substance abuse prevention in the K through 12 curriculum and nearly doubled childhood immunizations in her state. She has been standing up against racism and unequal treatment her entire life. What you may not know about her is that when she attended medical school at the University of Arkansas in 1956, despite the Supreme Court declaring separate but equal education unconstitutional 2 years earlier, she was required to eat in a separate dining room with the university cleaning staff. She has since gone on to become an esteemed professor of pediatrics at that same institution. Is currently retired from medical practice and professor emerita at the University of Arkansas School of Medicine. Our second guest is Dr. David Satcher, who served as the 16th Surgeon General of the United States, also appointed by President Bill Clinton in 1998. Born in Alabama, he was inspired to become a doctor after he nearly died of whooping cough, but was treated by a Black doctor who came to his parents' home. His esteemed career has included developing and sharing the King Drew Department of Family Medicine in Los Angeles and helped developing the medical education program there. He's also served as president of Meharry Medical College in Nashville and directed the Centers for Disease Control. During his term as Surgeon General, he released important reports, tobacco use among racial and ethnic minority groups, and the promotion of responsible sexual behavior. What you may not know about Dr. Satcher is that he was arrested several times while in college, while he was active in the civil rights movement. He currently serves as founding director and senior advisor of the Satcher Health Leadership Institute at the Morehouse School of Medicine. I want to welcome both of our guests and thank them for being here. So let's just get right into some questions and discussing the important role that public health can play in Alzheimer's. You're both trailblazers in the field of public health. Can I start by asking, let me start with Dr. Elders, what brought you to the public health field and how has it changed over your career?
Well, I think I came to the public health community in a roundabout way. I was kind of drafted I was a pediatric endocrinologist on the university faculty, but I did lots of public health as a professor in rural Arkansas because it was absolutely essential. But Bill Clinton asked me to be the director of health. And I want you to know it was the most rewarding, wonderful job I ever had. I never enjoyed medicine so much. I went all over the country, all over Arkansas anyway, meeting people. I took care of the individual patient in my clinic or in my office. And it was getting out, meeting all of the people in public health, meeting the county judges, the public health nurses, the teachers, and the families, the churches, and the schools. It was just most rewarding. And if you can imagine, when I went to when we went up to set up a school-based clinic, it was the churches that bought us, all of the public health people, lunch out and served them and thanked them for setting up the clinic. And it was it was a local dentist that offered to do dental health for any children that was found to have a problem. Well, that was almost every one of them in a rural school there. But the thing of it is, we're talking about a rural white, Black Arkansas, and they wanted the school children to come, so the school got permission to take the children to the dentist, and they said that rather than bringing them in with all of their other patients, which was usual in Arkansas, if they would bring them in on one afternoon. So they closed their whole office to have these children come in. The school bus brought them, and they waited to take them home since we were in rural Arkansas. And so that was how I ended up enjoying everything so much. But it was just such a delightful time. And so in many ways, I was thrown into it. But I want you to also know about me. I worked at a doctor. I didn't know what I was doing, but for a nursing home for almost 30 years. I was the nursing home doctor. She was running the nursing home for my friends. And I want you to know that probably now in recommending for the future, I might recommend something a little bit different than nursing homes and the way that this was managed. I thought it was managed very well. I thought it was a very good nursing home. I don't mean that. I mean, the fact that there were so many of us there, we didn't have the kind of social interaction that they're doing with the greenhouse project, different kinds of advances now. So I think we can do a much better job for our seniors, for our patients that we're seeing with Alzheimer's. And I want you to know, my mother-in-law lived with us for 6 years with Alzheimer's. And I remember her daughter coming into our home, and they was coming to visit their mother, but they said that they could not stand to feed her breakfast, or after I had gotten her all, I would get up, get her bathed, fix her breakfast, and do the things I needed to do to get. So I'm just saying we can do much better now. I felt that she did not get nearly as much interaction. We tried to do a few things, but what can you do in a home?
Yeah. Thank you so much, Dr. Elders. Let me turn to Dr. Satcher and first for maybe this overview question on how public health is changing over what you've seen over your long and distinguished career.
Well, thank you. It's a real pleasure to be here, and especially to be here with Dr. Elders. We define public health as the collective efforts of a society to create the conditions in which people can be healthy. I think that's a very important definition. In words like collective efforts, in other words, people working together, create the conditions. You have to have certain conditions in order for people to be healthy. It relates to the air, the water, the safety, and all of those things are really critical. And certainly we know that when it comes to Alzheimer's disease, we have to be concerned about the conditions to prevent the worst forms of Alzheimer's, but also the conditions necessary for people to be able to function with Alzheimer's. I said last night that I learned a lot about Alzheimer's, perhaps more than I wanted to know, because my wife, Nola, who was a poet, had Alzheimer's for the last 20 years of her life, and her mother before her had Alzheimer's. So I learned a lot about Alzheimer's in a way I would probably prefer not to have learned it, but my wife was a beautiful person and wrote beautiful poetry. And I can only say that I think when it comes to public health, the question becomes, are we working together to prevent dementia? Are we working together collectively to make the best of people's lives if they have dementia, especially Alzheimer's? And that's very important in the definition of public health. Let me say that I think we don't have a cure for Alzheimer's, and it would be unfair for us even to say that we have an effective treatment, but we still have to find a way to make the best of the lives of people who have Alzheimer's. And I think we have more to work with today than we had before, but we have to continue to work to make those conditions better. And we have to work together. I think the CDC program, which supports what we're doing in the Satcher Health Leadership Institute and the Alzheimer's program, is very important, because we have to take what we have and make the best lives for people who are burdened with Alzheimer's disease. So I'll stop there and follow up later.
Thank you. I mean, I think it's amazing that, like so many Americans, you both have been individually touched by Alzheimer's in your own families. So I know that gives you a lot of compassion and insight. You both jointly wrote with other Surgeon Generals in an op-ed in the Orlando Sentinel, brain health should be as much on people's mind as heart health, breast cancer, and the war on smoking. Let me start with you, Dr. Elders. I mean, you're a pediatrician, so you're sort of at the other end of the age spectrum. Why has brain health become a priority for you?
Well, I think brain health is a priority for me, is because I mentioned about my mother-in-law, but you have to remember, as you said, I am a pediatrician, and I think you have to start early. I feel that we do, to make a difference, we do too little, too late. We could do more. We even know how to do more things, but we work on it too late in life. You know, I'm always telling people children are half as tall as they'll ever be by the time they're 3, know half as much as they'll ever know by the time they're 4. So we've got to get started in getting the children organized, thinking, and involved, and hope, will, and drive has been determined by the time they're 5. But if we think about our senior citizens, we've got to keep them involved. You know, if we don't ever stimulate them, it's like children. If you don't stimulate, if you don't read to them, if you don't get them involved, or if you don't have them have some type of relationships with others. So I think we're learning more, we're doing more. I think them going to daycare if necessary, or getting out involved, you know, when you're dealing sometimes with a family who don't want them to go to daycare because they don't want other people to know that they're not functioning as well. You know, we've got to do a better job of educating families so they can appreciate the fact that it's not for them, it's for their parents, whom they don't want to go out because they don't want anybody to know. You know, they've been the principal, they've been the teachers, they've been leaders in the community, and they don't want them to know. We need for them to be involved. We've got to get we can do a better job with making sure that our parents who have problems get the proper care.
Yeah, that's an important point, that the secrecy is kind of keeping people from getting the best care they need, and the sort of issues of shame.
Yes.
Dr. Satcher, let me ask you, the brain is such an important organ. Why, we focus on the heart, we focus on cancer. Why has brain health been left behind? Why is it not, more front and center for Americans?
Well, I think it's getting more front and center every day, but I think we have been afraid to say much about the brain because it's the kind of organ that you can't easily access without doing harm. And so it's unlike other organs in the body. The brain is really the predominant organ, even though it might constitute only 2% of the weight of the body. It is much more important than that in terms of the role that it plays. When it comes to how we live, I think clearly physical activity, good nutrition, avoiding smoking, avoiding drugs, all of those are areas that are critical for the brain to function normally, for the brain to function properly. And so we have that responsibility to nurture the brain in terms of the way we eat, the fact that we have regular physical activity and good nutrition. All of those things are critical for the development of the brain. You know that there are people who don't have the opportunity that other people have to be physically active and to engage in good nutrition. So we now know that probably 40% of Alzheimer's disease is preventable. However, in order for it to be prevented, we need regular physical activity, we need good nutrition, and there are still children in this country who don't have access to safe places to play, don't have access to nutritional foods. And so we need to stop and say, what is it that we can do now to improve the outcome and to give children the best chance of developing normal brain function. And that's something we can do. And yet we have to admit, we still have a lot to learn. So the brain is also a place where we have a lot of research that still needs to be done. And we have to get about the business of doing it.
Yes, you mentioned, some children not having access to open space and maybe people not having access to healthy food. It kind of feeds into another question I had, which is, is the opportunity for brain health equally shared by all Americans? And what role are racial inequalities possibly playing in keeping, some communities from not having the best opportunities?
It's a very important question. And clearly, we don't have equal opportunity to be healthy in this country. We don't have the equal opportunity to be healthy, and that goes for the brain as well. And so we need to be about the business of making sure that more and more every day we have equal opportunity, equal access to brain health. Mental health is interesting, and I did a Surgeon Jones report on mental health. But the interesting thing is that when we talk about mental health, we tend to put it in a category as if it's not a normal outcome of day-to-day activities. But mental health and mental illness, brain diseases, and we got to the point where we almost need to call it a brain disease, because then it tells us the kind of things that we need to be doing in terms of prevention, but also the kind of things we need to be doing to help children develop at their optimal development.
Dr. Elders, we heard from Congresswoman Sanchez and your former Surgeon General, Dr. Cremona, about these tremendous opportunities we have to prevent dementia. What do you think is standing in the way of realizing these opportunities?
Well, I think part of the thing that was standing in the way in the past is, you know, we didn't know as much about the brain as we do now. I think every day we're learning more and more and more. I think, you know, our high tech, you know, CAT scans, MRIs, and other, you know, kinds of things, metabolic activities of the brain, we're learning more and more. We also learned an awful lot about the fact that what lead did to brain, and we're still having problems with lead pipes and drinking water in many of our big cities, and we know that destroys certainly children's brains. We've learned an awful lot about the brain when we were able to diagnose that certain endocrine disorders like hypothyroidism, most common cause of severe mental retardation and brain development, was children born with thyroid deficiency, and they weren't treated until very late. Well, now with screening, and now we're able to treat them very early, and we've really almost gotten rid of early childhood mental development related to hypothyroidism. So I'm saying we were learning more, we're using a lot more, and we're learning ways to stimulate children that we think that are, you know, are maybe not fully functioning at the level we think they are, and the things that we can do better. And I think that as we learn more and apply this to children, we'll begin to apply more and more to our senior citizens and adults. You know, so I really feel, and if we apply good, better nutrition, really push them to stimulate them to get out and exercise more. We don't have to push them much. They want to get out and exercise more. Part of the time it's us. You know, we don't want to take them to the park and sit and look at the birds. And so I'm saying that I think, as you said, part of the problem is us. And I think we can do better. We want to do better, and we all try to do better. We've got to learn better. We feel we don't know enough, but we've got to get over our shame, you know. And I saw that, and I think that the shame that I saw that in my family was related more to the fact, to ignorance. They just didn't know better. They want to do better. And so I think we have a big teaching job ahead of us in educating all of our citizens about Alzheimer's disease and make it well known, better known, make it, you know, acceptable as a disease. And, you know, I'm not talking about, you know, we all accept our family, but, you know, sometimes we don't really accept it as much of a disease. And I think if we know more, knew better, we would do better. And I think we're trying. And
that's a great point.
Like
I want to let our audience know that they can submit any questions for our guests via the live stream platform, and we'll be taking those questions and answering them as they come in. Let me ask this very timely question to Dr. Satcher. We've seen COVID-19 devastate families and entire communities. I'm wondering if you have any thoughts on how the Alzheimer's epidemic is linked or interlinked with the COVID-19 pandemic. And are there any lessons we can apply towards Alzheimer's?
Well, that's a very important question. And I must say, first, I should begin by saying there's still a lot we don't know about COVID-19. I mean, there's still a lot we don't know about Alzheimer's, but there's especially a lot we don't know about COVID-19. And I'm afraid that we're going to learn some things that we're going to be really sorry about in terms of this disease, in terms of its long-term effect, what some people call the long haul. There's a study going on now in which people are studying the brain of people who've had COVID-19, and over a period of time doing repeated analysis of the brain and how it's functioning, doing memory tests, things like that. So there are two things that need to be said. One is that we talk about disparities in health. And what we now know is that those disparities that we've been talking about can become the setting for difficult problems when we encounter a virus like COVID-19. So COVID-19 impacts African Americans, Hispanics, and others more severely, in part because of disparities when it comes to nutrition, obesity, diabetes. Those diseases in which there are disparities also represent a setting to be more severely affected and more easily infected by the COVID-19 virus. So when I hear people talking about why they don't want to get a vaccine, what bothers me is that I'm afraid that we might just find that the COVID-19 virus is more serious than we've even thought when it comes to the long run. So we do need to really push to get rid of this virus as soon as possible.
Yeah, it's very worrisome. Let me turn to a question from the audience. So a federal advisory council recently recommended that our national Alzheimer's plan be updated to add a focus on risk reduction. I'd like to ask, why is this important? If any of you can talk about maybe some of the key risk factors, or if you had the president's ear, which maybe you both do, what are things we could maybe do on a national level to cut these risks? I'll start with you, Dr. Elders.
Well, I think the president's had made a lot of suggestions that we cut the risk of getting this disease. We're fight up. We talk about masks, social distancing that we really did early. But usual public health things that make good sense. So we've talked a lot about that. But I think we really, and then we get to immunizations, and then you just said, we hear people, well, I'm not going to, because I don't know what's going in me and how fast it was developed, But, I feel that, again, we've just not done it good enough. A job of educating all of our people, to make sure that they understand what the problems are. And even though they may know them to repeat the words, they still, there's a difference between knowing the right words to say sometimes and really knowing what the real significant meaning of and understanding truly what's going on. So we've got to do a better job. And I think we've got to do a better job of really starting, again, we start early with children with those immunizations, but we just give them, and we don't really always talk about the meaning. We've got to protect not just ourselves and our family, we've got to protect the whole community. It is involved all of us. We've got to make a difference for everybody. And so I think that those are some of the risks, I think, and we know that in very underprivileged communities, rural communities, communities of color, when we talk about social distancing and washing hands, some things, if you talk about washing hands, if you have no running water, and then we're talking about some even having lead in the water that have running water. So we've got lots of problems still out there, and we've got to listen to them and get out there and start trying to grow.
Let me circle back more to the aspect of the question that was about risk factors for Alzheimer's, and maybe turn to Dr. Satcher. Are there, would having a national prevention goal help, or what are some of the key risk factors you might be most important to target from the start?
Well, we're still learning a lot about Alzheimer's, but clearly it tends to, quote, run in families. In other words, you're at greater risk for Alzheimer's. If, my wife was at greater risk, her mother had Alzheimer's. we can't say exactly what that risk is. You know, in genetics, which I studied for a few years, we like to be able to say what the risk is and how much greater it is than somebody who was born in this family or that family. It's not that kind of risk, but clearly people who born in families where there's Alzheimer's disease are at greater risk. And therefore, the more we learn about that risk, hopefully the better we are going to be prepared to deal with it. But I do want to say one thing I think it's good news, and that is that clearly now we know that not everybody who gets the genes for Alzheimer's is going to be at equal risk for having the disease. And that's true of a lot of diseases. And of course, in the case of Alzheimer's, regular physical activity, good nutrition, early education, all of those things reduce the risk of having Alzheimer's disease. It doesn't reduce it to zero necessarily, but clearly we know that it reduces the risk.
Yeah, that's really important. Sounds like that message has to get out more loud and clear, as Dr. Elders was saying. You've both referred a few times to the family members that you have personally helped care for and direct. And so I'm wondering, Dr. Elders, can you talk about how Alzheimer's is really a family issue and why family awareness is so important? And more about what family members can do to help. So many people are overwhelmed and frustrated and scared. What would you, if you could sit to talk one-on-one with a family member, what would you say?
Well, you don't know what you'd say. At least I don't know what I would say. But I think that we all want to say when Dr. Satcher defined public health, we all want them to have all of our family members or to have the very best health that they possibly can. And we all want to do what we can to ensure that they have the best health possible. And it just says some members are scared. They're really scared. They're saying, oh, well, they're a little bit crazy or whatever. Well, and we not accepted mental illness very well in our society. We walk around being ashamed of the fact that somebody in our family or somebody we know have a mental illness. So then they began to think Alzheimer's is, because they're losing part of their memory or not thinking as clearly or doing well, then but we need to understand what's going on and really do the things we can to try to help them, to try to make a difference and try to get them involved and keep them involved, have them talking to other people, and make sure that when we have meals, we don't take their plates in and put it in a place separate. We want them to always have meals with the rest of the family, to be involved in the conversation, to talk. Those are simple-minded things that we could all do with no problem. And again, we want to give them as much exercise, as Dr. Satcher said, as we can. We even if we say, well, let's walk out and look at the birds. If they can't walk out and look at the birds, walk up and down the hall 10 times a day. Different things. We have to just devise things to really get them involved, keep them involved, and to stay involved.
That's great. I'll take another question from the audience, which is a good one. I'll ask you this, Dr. Satcher, since you've had a career in medical education. This person's asking, medical school curricula seldom include brain health, healthcare disparities, topics like that. What can be done to increase that type of education, or is that changing already?
Oh, I definitely think it's changing already. I would even go as far as to say it's not changing fast enough, but it is changing. And even when I was a student, which was a few years ago now, it was beginning to change. And we need to know much more than we know about the brain. But clearly, mental health is on the table now. And even though for some people, there's still embarrassment around it, we used to say when I was in Los Angeles, I know you're from Los Angeles, we used to say, Los Angeles, the Los Angeles jail is probably the largest mental institution in Los Angeles because people arrest people who are mentally ill. If they don't understand why they're acting the way they're acting, they often will end up in jail or in prison. And that's unfair. It's unfair for people who are suffering with an illness, a mental illness, to end up arrested and abused because of it. So we need to educate everybody. And I want to make this point because it's important. When it comes to mental disorders, we need to educate all of the children about them. They need to understand not just themselves and their risk or their siblings. They need to understand other children who might well be suffering from mental disorders. And therefore, to be able to create the kind of environment where people can live together and continue to deal with the conditions with which we live.
It's a really great point. And again, just more conversation, more openness is clearly needed
Yes.
on this topic. Let me ask, this is something that really intrigues me. You've both talked about wellness checks for the brain as being an important part of primary care or the annual physical, but I think that's still really rarely done. Dr. Satcher, can you just, you have a background in family health. Can you describe what it might look like, or what can a patient or a caregiver do to ask or encourage their physician to do something like this when they're getting their heart checked and their blood sugar levels checked? How can they get their brain checked as well?
Well, they shouldn't have to, but they do. You're right about that. Parents should not have to ask physicians to check the brain, but they often do. I think it's Patrick Kennedy who talked about a complete checkup from the toe to the top of the head. Clearly, when it comes to doing a checkup of a patient, we can't do it without including the brain. We can't do it without including mental health. We've got to be able to include that as a part of the person. When we don't do it, we send a message. Now, I can be critical of parents here too. I can say that a lot of parents, because of the stigma surrounding mental disorders, won't in fact take their child to a doctor and say, I want you to check his mental health, because it's almost like you're supposed to be embarrassed if somebody has a mental disorder. You're not supposed to be embarrassed. It's another health problem just like any other. It just happens to be the brain, which is probably the most important organ in our body. Not probably, but is. But the fact of the matter is that people, out of shame, if you will, often will ignore problems of the brain. And I think it's a feeling of almost hopelessness. It's not just shame, it's almost hopelessness that there's nothing we can do. Well, there is something we can do, and every day we're learning that we can do more. And we can do more as individual physicians to individual patients, and also do more in public health. In other words, public health can do more to create the conditions in which people can be healthy, even though they may be struggling with the mental disorder. Public health can do better. Public health can work with families where there's a person with Alzheimer's disease. So there's more we can do in public health, just like there's more we can do in medicine.
Yeah, I think that's a great point. I think we should end on that really strong and important message that there's a lot we can do to prevent Alzheimer's, and there's a lot we can do at individual level, family level, physician level, and national public health level. I want to thank all of you for joining us. I want to thank our two guests. I want to thank Us Against Alzheimer's for all the incredible work they do for all people. Thank you for joining us.
Thank you.
It's a pleasure. And some physicians do kind of try to do what they can do to check our brain health, by doing certain tests. I realize they don't give you an exact answer, but at least they make you think about it and make it look and say, well, it's stable, or you probably don't want to tell somebody you're going down fast, but they already know that before you tell them.
Just following up on what Dr. Elders is saying, we talk about public health, and I believe that public health can make a much greater contribution than we are making. Clearly, public health can create an environment in which people feel comfortable seeking care, for mental disorders. Public health can help to do that, but we've got to be willing to talk more about mental health and then to make it stick. It's almost like Luther Terry said, who was the first person to do a report on smoking and health. He was on the way to the press conference, and his assistant said, "Well, Dr. Terry, the first question they're going to ask you?" And he said, "No, what's that?" He said, "They're going to ask you if you smoke." Dr. Terry was smoking at the time. So they went on to the press conference, and Dr. Terry did just a great job of presenting the report. First question, "Dr. Terry, do you smoke?" And he said, no, I don't. And the reporter had done his job. So he said, "Dr. Terry, when did you quit?" He said, "I quit 30 minutes ago." And he never smoked again. He never smoked again. He walked around with a lapel pin saying, "Thank you for not smoking."
That's wonderful.
I
Thank
know
you.
that's stretched a little bit, but.
Yes.
Okay.
Thank you, everyone.
Thank you.
Thank you.